We've got a very powerful panel. We've got Governor Mike DeWine coming back on. This is his third time on Alicia Reece Food. So we want to welcome him back. We also have Dr. Richard Lofgren, who is with the UC Health CEO. And we also have the president of the Cincinnati NAACP, Joe Mallory. We have our health commissioner for Hamilton County, Greg Kesterman, who is on. So all of your questions, and Renee McHaffey Harris will be joining us from Closing the Health Gap. So tell everybody, get here. I've got some of your questions. We're going to get right to those questions that you've been asking, and we'll be able to ask the governor directly. So I just want to make sure, are we live already? Okay, we're live. We're ready to go. Governor, welcome back. Welcome back.
It's good to be back. Thank you very much. Appreciate it.
Yes. Well, listen, I'm going to jump right in. COVID-19, we had hoped it would be over with. We were hoping it didn't hang on and hang around as long as it has. None of us were prepared for that. But let me first say that you have a very tough job. I want to acknowledge that. No one could be prepared for something like this. And so those who are in leadership, this is a tough thing that we're trying to all work through, making sure that people's life and their livelihoods are secure at the same time. I don't think we've ever been hit like this before, where your health is hit in a crisis and your economic is hit at the same time. It's usually one or the other. So I want to jump right in, Governor. We were talking before about last time you were on about the vaccine. You were hopeful. You said, hey, we get these vaccines. This is something that we, will be able to, fight this COVID situation. Now that we have the vaccine, of course, we don't have enough supply. But I want to jump in and ask the question that people have been asking me. They said that I believe Virginia is supposed to be number one in dealing with this. And we didn't fare too well in terms of our distribution. Can you talk about
Yeah.
our difference, or why you went the way, or going the way that you're going as it relates to our distribution in Ohio?
Yeah. First of all, by the numbers, we are the 7th most populated state in the union. We are 7th in getting first doses out, right where we should be. We're 7th in getting second doses out, right where we should be. And the combined doses, we're 7th in that as well. But what we have done differently than some states is really focused on the most at risk, and have really spent time trying to do that. So, for example, over half of our deaths have come out of nursing homes. We have more nursing home beds in the state of Ohio per capita than any state in the union except one. So we're number 2. So we got 940 nursing homes. We've got 700 and some assisted living, so 1,600 places. And what we did is on day one, in fact, we asked the federal government to allow us to start 4 days early, and they did. We started vaccinating nursing homes. So we have now gone through the nursing homes once, the first shot, second shot has been administered. We're almost through all the assisted living with both shots as well. And what has happened is we've seen a dramatic drop in number of cases. We're about 1/4 of cases, and they're dropping like a rock. And so when that happens, what you're starting to see already, and it's going to continue to expand, fewer people are going to die in nursing homes. And the other thing is that fewer people are going to be going into Dr. Lofgren's hospital or any other hospital in the state, because half the people that have been going into the ICU, for example, are coming out of nursing homes. So that's a real focus. Second big focus that I don't think some states are doing is on people who are the most vulnerable, who are not old. In other words, people under 65, but they have a particular disease, a sickle cell anemia, for example. So we have created this group. Another example would be someone with Down syndrome. They all have a much higher rate of death than the average person would. So we've taken that group, 200,000 people roughly. Beginning on Monday, those individuals are going to be able to get the shots. Again, that may take a little time, maybe a little slower, but it's getting the most vulnerable people that we have shots. Finally, we're really going into working with our local health departments to try to bring the vaccine to people of color, try to bring the vaccine to people who are disadvantaged. Some states have gone to 8, maybe 10 big sites. We said, no, we're not going to do that. We're going to go into every county. We're going to go into every community. And we now have about 750 sites where people can get the vaccine. Next week, we're going over to 900 sites. And that's all distributed based upon population. So if you live in Hamilton County, you're going to get your fair share. If you live in Adams County, much smaller county, you're going to get your fair share. But Alicia, the big problem is, there just isn't enough vaccine. And so we've vaccinated in Ohio 1 million people, a first shot, and we're moving on the second. That's about 10% of our population. So we're on track, but we're really putting a focus in Ohio on people who have the most vulnerability. So age, 65 and over. 87% of all the deaths in Ohio have occurred among people 65 years of age and older. So we are focused right now, in addition to these other groups I've talked about, we're focusing really on people who are 65 and over. If you would go down to 50, which someday we're going to be able to do, we would knock out about 97% of the deaths if we could get everybody vaccinated. So we started with people 80 years old. As of yesterday, I haven't seen our totals today, we were better than 55% of all the people in Ohio who are 80 years of age have been vaccinated. So we're moving. We wish we had more vaccine. When we get more vaccine, we're going to put it out into obviously more places, and we're moving ahead. So I think we're doing well. We've got great partners out there. Local health departments are doing a phenomenal job. Hospitals are doing a great job. The pharmacies are doing a good job. But for the average person who's listening to this or watching this, there is a frustration because if they're 65 and older, they may not have been able to get a shot yet. And the only thing I can say is I'm not asking you to be patient, because I wouldn't be patient. I'd be very impatient. But you're going to get your shot. And just keep trying, and we're going to keep pumping it out, and we're going to stay at the age 65. We're not going to lower it for a while because we want to fill up that 2 million people. We got about 2 million people 65 years of age and older, and we got to get them vaccinated.
One of the things you mentioned, African Americans, obviously, we've talked about this, and Renee McHaffey Harris has joined us from Closing the Health Gap. Thank you. And she's going to be on our panel afterwards. But African Americans, they've been asking us to do these campaigns and get African Americans ready to go. But what I've seen as I have, been across the county, African Americans, we've got them ready to go, but they don't have the shot. So how will we do, for example, the councilwoman, Linda Childs Jeters just hit me up. She says Lincoln Heights, one of the first African American, municipalities in the state and possibly in the country. She said they're ready to go. And, are we keeping any data? What is the data and what is the outreach? Because we want to make sure not only that we go to these communities, but that those communities are the ones that get the shot. We've done some good efforts, but the Ohio Legislative Black Caucus has expressed concern. The Greater Cincinnati Urban League just sent, I believe, a letter to you. They copied us on it. They're concerned. NAACP is concerned. How are we keeping data and ensuring that African Americans are not left behind?
Excellent question. Let's start with the data. If you look on our webpage, you'll see the percentage of African Americans in the state based on total population that has been vaccinated so far. You'll see the white, you'll see other breakdowns, Pacific Islanders and others. Now, part of the problem that we're facing is we have a lot of people who don't want to put race down. And so they're not putting it. So there's a big gap there, which we just don't frankly know. And we can't extrapolate, we can't assume anything. But Alicia, you'll see in there, we're very transparent about it. And it is what we feared and what we're seeing in other states. And that is we're running behind with African Americans. So all of us together, working together, and I want to put the emphasis on working together, have got to work on this. And there's two things that we can do. One is make sure that the vaccines are available to people of color. And that means going into the neighborhoods, going into the communities. For example, today we're, I think, in 3 different senior housing places in Cincinnati. where we've got a significant number of people of color. And we're going right in there with the National Guard. We're going right in there and set up shop in the lobby, set up shop right there. So all people have to do is come down from their, their apartment where they live and get vaccinated. So taking it to people is very important. I would invite anyone who is watching this or listening this to contact your county health department, contact your city health department, contact us. If you've got an African-American church and you want to host a place and you think you can get people in there, we will come in. We'll take a half a day. We'll take a day. We'll put a team in there and we'll work with the local health department and we'll get people vaccinated in that church. If you've got another location that you want us to come to. And I know Mayor Cranley and I've talked a lot about this, and he's very focused on this as I am. And we just have work that we have to do. Lincoln Heights, for example, look, if there's working with the local health department, there's a place we need to go there and set up shop, we need to do it. We're doing the same thing at the other end of the state. We've got a meeting with the mayor of East Cleveland coming up next week. So it's a work in progress. We're not where we want to be yet, but we know the challenge. The second part of it, though, is we have to continue to educate everybody. We started off with over half the people in the state saying, I don't want a vaccine. I'm scared of a vaccine. Those numbers are changing, but getting people of color who are taking the vaccine and who are community leaders and who people respect, it's no different in any other community. People respect people who they know and who they trust. And so that's part of what we're doing. We've been on radio, African American radio. We have more plans to be on. We were on before in regard to the whole issue of wearing a mask and testing and things. We're going to go back on and with ads specifically in regard to the vaccine. And, it is a safe product. So
absolutely. Yeah, I just wanted to make sure we've been promoting it and, and that's a great thing. But when we promote it, we don't have people getting access.
We got to do both. We got to do both. But we can't wait for one to do the other. We got to be doing both at the same time, and we can do two things at once, and we got to do it.
Absolutely. Other question comes from Jackie Taggart Boyd. She is in the hospitality industry for many, many years. And she wanted to know, how do you make your decision in terms of who is, essential? In other words, I even found out, I guess, police wasn't necessarily in the front of the line. When would they be at that front of the line? And she's concerned about that.
Yeah. We've listened to the doctors. We've listened to the experts. And we've gone by the math. We are not using the term essential workers because, quite candidly, everybody is essential. I mean, you want to try to break it down that way. So we're not doing that. What we're doing is we have really three goals, and these are in no particular order, but three separate goals. One, to vaccinate our health workers, people who are on the front line protecting us. We're not done with that. We're going back to it, but we've done a lot of those individuals. Second, we got to get our kids back in school. So we're taking the month of February. And in addition to vaccinating older people, we're focusing on any school that has agreed to go back into the classroom by March 1. And we had every superintendent sign on the dotted line that said we will be back in at least hybrid by March 1. And in return for that, we will get the vaccine. So we're now completing our second week, almost halfway through of doing all the schools. But the biggest chunk of people is people who we need to vaccinate to save lives. In other words, these are people who have a much higher risk. So as I said, 65 and older, 87% of our deaths. Nursing homes, 50% of our deaths. So by getting those people covered, we are, saving lives. We're keeping people out of hospitals. Now, we have received over 700 letters from different groups who say, I want to be next. In fact, not only are they saying, well, I want to be next, I ought to go now. And each one of them, if you read it, it makes a good case. But I can't, if we've got a 35-year-old person, whatever his occupation or her occupation is, and they say, look, I need to really go next. What that person is really saying is, I need to go ahead of my grandmother who's 85. And I think that's a bad choice, because a 35-year-old generally, even if they get COVID, we've had some people die, we've had tragedies, but the statistics are that the 80-year-old is so many times more susceptible to death. And that's where we're seeing our deaths. So we've got to take care of this 2 million people, as many of them as want vaccine, 2 million people who are 65 years and over. We got to take care of the 200,000 people in Ohio who have sickle cell anemia, some other thing that makes them more vulnerable. And we think that's the right thing to do. And we know we make a lot of people mad and we disappoint a lot of people, but to me, it's a question of saving lives, and that has to be our priority.
Someone said, why did, when it came to of course, the schools is very controversial. Shonda Monroe, who listens to our show as well, she was concerned about that. She wanted to make sure that the teachers had shot 1 and 2 before going back to school. Was that something you considered?
Look, we can't do everything, and we can't do everything at once. We didn't have enough vaccine to get everybody vaccinated the first week in February. What our commitment has been is that everybody will have a first shot, which gives them significant immunity, not the full immunity, but certainly gives them significant immunity. But I would say this to any teacher who's worried about going back in, or any custodian or bus driver. I understand, but we know a lot more today than we knew at the beginning of this pandemic. And what we know today is that in our classrooms, and we've been doing this now for 7 months, 6 months in class, the schools that have been in class full 5 days a week are showing very, very little spread in the classroom. Why is that? They're wearing masks. And even when they are less than 6 feet apart, we are showing very little spread. And I'll tell you what we know. We were following the CDC guidance, and the CDC says, look, if you're within 6 feet, you're closer than 6 feet, and somebody has the virus and you're together more than 15 minutes, which would mean anybody in a classroom who's right next to that student who came down with COVID, you've got to isolate. You've got to be quarantined for, I think, 14 days or so. Our principal started calling me, and our superintendent started calling me and said, Mike, this is a problem. Look, none of these kids, we're quarantining them for this whole long period of time. They're missing school. None of them are getting sick. None of them are coming down with it. So he said, okay, let's go into the schools. Let's take 7 schools. We went into these schools and we did a trial, and we actually started testing people. So you'd get a kid in the classroom, he has COVID or she has COVID, then we'd take all the kids around them who are within 6 feet, but more than between 3 and 6 feet. And we would test them and would start testing them. And what we found is, we did a control group as well. And what we found is the spread with the control group who had not been exposed was the same with the group that had been exposed, like 3.1%. So based on that and some national tests that were done, we changed our quarantine rules. And what we have found is that even if people are crowded in a classroom, but let's just assume they've got 3 feet of space, which you can have, but they don't have 6 feet of space, virtually no spread. So you put that together with getting the first vaccine. Everybody's going to get a second vaccine in March. Some will get the second vaccine in February. So we think the schools have done a phenomenal job. They've been we got schools who have been out for a year. We've got schools that have been in for a year, and the ones who have been in who followed the mask compliance, and we've learned that kids will wear a mask and they will comply and they'll do a good job. We're not seeing that much spread at all in the classroom itself. So I think that teachers, if they look at those facts, or a bus driver or a cook or whoever, is going to say, look, I'm getting the vaccine. We have almost a year school experience of kids not seeing spread in the classroom itself. I think that should give some people some confidence that they could, this is something that they can do. So we asked everybody, will you agree to go back March 1? Everybody except one school in the state said yes, all the public schools. And frankly, we expect them to go back March 1st.
Well, Governor DeWine, I know you have to go. We'll have to have you come back on. But I wanted you to get a chance. This is your third time coming on, giving us kind of an update. I like the fact that churches that are listening, and we'll have our health commissioner in a minute be on, so you'll be able to talk about how to have those kind of things here. And again, like I told you earlier, certainly Hamilton County, you know, I'm always going to be pulling for us to get our fair share. So I always will be bugging you about that fair share of vaccine, fair share of dollars. And I'm leading a new task force called the Economic Recovery and Relief Task Force, dealing on the economic side. So I always say we need 3 shots. You get the 2 shots for your vaccine to keep you healthy, but then we need an economic shot in the arm as well. And so looking forward to working with you. And already, I just want to let people know I appreciate your openness. We are trying to help reduce people's, their bills if we can help them. And one of the things, obviously, is in your water bills and those kind of things. And because the way we're set up in Hamilton County, we can't reduce your MSD bill because of an old state law. And they've got bipartisan working on it. And I appreciate
Okay.
you saying you'll take a look at
Well,
that, because we want to give people help and relief right now. So thank you, Governor DeWine. I
thank you very
appreciate
much.
it, and looking forward to continuing. Like you said, we've got to work through this together. So thank you.
Thanks, everybody. Appreciate it.
Thank you. I now want to go to our panel. We got an outstanding, powerful panel. Dr. Richard P. Lofgren, who is the CEO and president of UC Health. We have Renee McHaffey Harris, CEO and president of Closing the Health Gap. We have Joe Mallory, president of the Cincinnati NAACP. We have Greg Kesterman, who is our Hamilton County Health Commissioner. And I want to go to Dr. Lofgren first, and I'm going to move it around. Dr. Lofgren, we've been talking about, obviously, the issue of racism as a public health crisis. We are in a health crisis. And, a lot of people were concerned about the vaccine in terms of African Americans. They're still concerned. We'll talk about that. But some were concerned. And, a lot of times they're not involved in the clinical trials. I want to give a shout out to UC Health, because you guys were out front at the beginning saying, hey, let's get these clinical trials going. You want to talk about that and kind of where we are right now with UC Health and the vaccine?
Thank you. Address the clinical trials first, because a couple things that I think are important is that there is a lot of concern about the vaccine, concern that maybe somehow that the science was short-shrifted because of the acceleration. And I'm here to tell you that it was accelerated, but the science was maintained, and we followed all the same practices we do to make sure that any kind of vaccine or drug is safe, bringing it forward, even though it was very much on an accelerated time. The comment you made, though, is very important, both for this vaccine in general, that one of the problems we have with any trials is that making sure that the people who are in the trial represents the community by which we're going to use the drug or the vaccine. And that's been a problem ongoing, is that the people that are age, race, gender even can be not reflective of how the vaccine was used. So at UC Health, as you may know, we were one of 80 sites that was really in the Moderna trial. Really pleased that we were selected, and reflects the really incredible colleagues I have, but very intentional about making sure that we got particularly African Americans involved. In fact, the very first individual who was our very first enrollee was an African American male who is actually gotten a lot of, I think he was even on national television talking about the importance about participating. In of the sites that we were involved in, we were the site that actually was the most effective in enrolling minorities into the trial, enough so that the people from Operation Warp Speed came and congratulated the group. But it highlights the point that you make about how important it is that we know that we are looking at the safety, effectiveness in all the people that are going to be taking the vaccine. In terms of the rollout of the vaccine, I think there are and we can talk about it as some, is that as you started to roll it out, we're really looking at 3 different sort of channels of rolling the vaccine out initially. One was the traditional way through the health departments, which actually has experience about rolling out vaccination programs. However, this is a whole different magnitude. This is something that we've never really faced before. So it's necessary to actually elicit everybody. So the private pharmacies have been involved and the health systems have been involved as well. Initially, one of the things that the private pharmacies were involved in was really leading the charge of vaccinating the nursing homes that the governor mentioned. And now they're actually going to be part of the ongoing vaccination programs. Each of the health systems started to reach out to their patients as well as becoming available to the community. We set up our site at UC Health, and because we're dealing with older adults, we really wanted to find a way which was easy for them to not have to walk, park, and the like. So we actually did it as a drive-up through our new, clearing out our garage at the Gardner Center, and had people drive in, but took and walk in and try to solicit people to be able to participate as well. But our capacity to deliver vaccine far exceeds the vaccine we have available. So one of the things you're going to hear from anybody who's involved in this is that we're setting this up, but you said it, are we getting our fair share? And then the second issue is, are we getting it in a way that people in every community, particularly minority communities and people and individuals who have transportation issues? And that's where I think that the work, and I know that the Commissioner Kesterman can talk about, is really a lot of activity, making sure that we start to address the issue, because even coming out of the gate in the first 4 weeks, we are seeing differences and discrepancies in terms of the vaccination rates amongst the white population versus the African-American population within Hamilton County.
That's a good segue to bring in Commissioner Kesterman into this conversation. Obviously, I'm hoping that we get more vaccine in, but talk about that. You're going to be, that's an issue I know that we brought up in terms of African Americans, who are the major target in terms of the highest amount of deaths. What's happening at the county level as our county county health commissioner?
Absolutely. Thanks for having me on today. Making sure health equity is first and forefront is pretty critical for our department. And we have been doing this for many years with many of our programs, including our We Thrive program. I'm proud to say, when you look at the state dashboard referenced by Governor DeWine, Hamilton County, we're behind, but we're ahead of many locations in the state of Ohio. To date, of the vaccines given out in Hamilton County, 11% of those have gone to Black or African American people. And so it's not where we need to be, but I'm really pleased that we are ahead of other locations in the state of Ohio. Part of our plans moving forward include making sure that we're setting up vaccine clinics in communities that need to have the vaccine clinic. So we know there are minority communities that don't have great access to healthcare. And so we're making sure we're moving our vaccine locations around to those communities. In addition, we're making sure that we're trying to get 20% of the vaccine that we receive into those communities. But the caution I have is, I'm getting so little vaccine compared to what the county is getting. So next week in Hamilton County, I'm getting 700 doses of vaccine, but we as a county are getting much more. And so it's really important also for my office and the county commissioners to help me advocate to make sure that some of our federally qualified health centers are getting their fair share of vaccine, because they are serving this population that is most at need and most vulnerable. So we're working also with many partners on communication on making sure vaccine information is available and it's readable in a way that makes sense to the population we're serving. We're also partnering. Governor DeWine mentioned the Ohio National Guard is coming to Hamilton County right now.
Where's Ella?
And we are
I want
working
to make sure that you're both on the same page. I know you agreed to the Black.
1 second. Someone from your office there is
There we go.
Okay, there you go. That was Dr. Lofgren that said your name. So someone, go ahead.
No worries. So we're also partnering with the Ohio National Guard. Governor DeWine referenced that they are coming here to Cincinnati, Ohio today, and are hitting up 3 senior buildings here in the county. And so this is really exciting stuff. It's great ways to get into our community, and we're really doing the best we can to make sure that we're getting vaccine where it needs to be.
Joe, Mallory, President NAACP, I mean, locally as well as nationally, the NAACP certainly has been speaking out along with the National Urban League and about making sure that the data is there. I wanted to bring you in this conversation about how do we make sure, because, you know, we hear this, we got to get African Americans ready to go, and they're ready to go, a lot of them. And the best way to get others ready to go is that they see other African Americans actually getting the shot.
I agree 100%. I've been on panels that I agreed to participate in because they needed to see leaders in the community talking about the vaccine and how important it was, and to get the vaccine once it's available. And once we talked about the vaccine is in Ohio, they're starting to distribute it. African Americans, it's not that they don't want the vaccine. There's a lot of them that want it and it's not available. And Mr. Kesterman and Dr. Lofgren both said that transportation and the health disparities we have trying to have reach out to those who are hard to reach. There's digital access that they don't have, like, because they have a system where you can register online to pre-register to get an appointment when your turn comes up for the shots availability. But I don't know what the protocols are. And the community has been calling NAACP's office. There are people in our community that are calling our office because, for lack of a better, you know, they don't know the number directly to the health department or where to get information on the shot. So they'll call us and they want to know, how do I get registered so I can get me a shot? You know, so we're communicating with them, but it's piecemeal. I think PSAs would be another method to effectively communicate in ways that we receive our information, not just in one medium, but in more than one medium. You know, and then those that don't have internet access, you know, reaching out, they have phone numbers, reaching out to them that way. And also I want to know what protocols are when they have vaccines that are hard to get. What are the protocols when you've got all the vaccines given out for that day, and if there's some that can potentially go to waste, what are the protocols? What do you do? Do we just lose them because they're expired? Or do we go out and find somebody that we can give the shot to? I saw in the news, there was somebody in a snowstorm and they got people, they were in cars and started giving them shots. So what are the protocols here? Like, so we don't waste any of this valuable vaccine and in the Black community. When Governor DeWine mentioned that, you know, we were right where we needed to be, and we're 7th in the country as population and 7th as far as being on the ladder, I think we need to do better in 7th. I mean, if West Virginia and areas like that are beating us and they're more effective at getting that shot out to the people, we need to see what they're doing right. You know, we're a bigger state, but there's some creative things that we can do. And I'm sure Dr. Lofgren's team, when you're talking about accessibility, mobile accessibility, and having a mobile unit going to the communities, or having a way that people who can't get out and about, going to them directly to give them the shot. And I don't want to hear that African Americans don't want to take the shot. There are a lot of people who want the shot. They just don't know when their turn is, right, how to get it. I've talked to some seniors that have contacted us like, how do I get my shot? You know, I'm 80 years old and nobody's reached out to me, and I don't know what I got to do. So
I want to have and before on the marketing and PSAs, I'm going to have Renee talk about that. But before that, though, I do want to just go back to Commissioner Kesterman and Dr. Lofgren on what Joe just talked about in terms of how do we, you know, that is true. You know, people say, you know, you're calling all over the place trying to find a shot and shots that are left over. What do we do? So would one of you want to talk about that?
Yeah, so real quick, and Dr. Lofgren, feel free to jump in, but at a real high level, you know, we have a lot of people who want to get vaccinated, and the Governor DeWine talked about the number of providers, and Dr. Lofgren touched on this as well. The number of providers is really helping us get a lot of vaccine out to our community quickly. But one issue that happens when you have a lot of providers is we're not all using the same registration site, and it has created confusion. And if you want to get vaccinated, it unfortunately is not as easy as calling one location. You have to call several locations to get that vaccine. So at Hamilton County Public Health, we have a website, hcph.org, and it lists every provider and has a phone number for every provider. And for those of your listeners that are unable to use the web or don't have great access, using Hamilton County's CARES Act funding, 211 was set up to be another source to allow for folks to reach out, get information about those providers and how to call. At the end of each day, each of those providers could have some doses of vaccine left over. Now, there's a lot of misconceptions about the vaccine. You know, even Pfizer and Moderna vaccine can be kept safely in a refrigerator. So all of my clinics, at the end of the day, all of our vaccines in the refrigerator, except for the one vial that we are using to vaccinate those last couple folks in line. And so a bottle of Pfizer vaccine, for example, has 6 doses of vaccine within it. And if we hit 3 people with vaccine, we have 3 leftover doses of vaccine. We are using that vaccine to help vaccinate those pod workers or people that are working our vaccine clinics. We're using that vaccine for others in 1A and 1B, and we're using it on our law enforcement who have not yet been prioritized. The trick is, at the end of the day, trying to use that vaccine up quick. And I'm proud to report that my office has not had any doses of vaccine go to waste. And I'm not certain, Dr. Lofgren, do you have similar experiences with vaccine?
Yeah, I'd make 2 comments. The comment that Joe made is really spot on in terms of not only sort of the accessibility of the vaccination sites, but getting information to people, and it's very confusing. And and people, you know, will talk and try to register on 5 different sites in terms of pharmacies and health departments and whoever can get an appointment to them. And if you don't have the digital access, it becomes a limiter. And I think that actually is a barrier and really a significant barrier that we need to overcome in really reflects what you've experienced. At UC Health, one of the things we can do and have been doing is proactively reaching out to our patients. And quite honestly, proactively reaching out to patients we know that are hard to reach to figure out what they need, how they can get transportation. But to be quite honest, you know, it's still pretty limited in terms of really what we need to do overall. So I know that there's a whole plan that the city and health departments are doing about setting up more clinics in the community, as well as getting more vaccine to the FQHCs, which are really, I think, much more accessible and people know how to access them. Getting back to the specific post about wasting at the end of the day, we will at a day where we've done 400 or 500 doses, may have 2 or 3 doses. It's not a large number, but we do have a number of doses that is the end of a vial. We actually have a wait list, and we will tell people that if you can get to us within 30 minutes, we can vaccinate you. The problem with that, and it means that we don't waste doses, but it does mean that you have to have the ability to get to us within a very short period of time, which is not the same. It doesn't lead to the kind of equitability that you want. I will tell you, it's a very small number, though. I mean, at the end of the day, it's really what's at the bottom of one particular vial that we've had, and we're talking about 3-4 doses at most at the end of a vaccination day. So we don't waste them, but you know, it doesn't solve the issue that we have of making sure we have equitable distribution through our entire community.
I want to bring Renee McHaffey Harrison, CEO of the Closing the Health Gap. She's also on the governor's strike force, and also is working with our Hamilton County Commission and gave an excellent report, did some research directly talking to African-American consumers, but also is leading the PSA side of the campaign. But I wanted her to really talk about this strike force because she's on that all over the state with people who are raising this issue about equity. So Renee, I wanted to bring you in on this conversation on where are we with that.
Well, first of all, the strike force, so thank you, Commissioner Reece, and of course, everyone else on the panel. The strike force issued a blueprint because we were set forth with a task of saying, what can we do to ensure that we can make sure there's equitable distribution, equitable care overall. And so what we identified were a lot of gaps. And so that blueprint document said, here are the things that we need to build and retool so that we can have the ability to collect data across the state equally the same, so that we can then have better systems to meet the needs of Black, Brown, and other minority groups across the state. Then that document is something that we're continuing to work from. And then there was another group formed, a work group around the vaccine dissemination. I think that almost everything that we have discussed today, I can say, at least in Hamilton County, that we are working collectively. Greg, Commissioner Moore as well, we have begun meeting some weeks ago so that we could leverage the mapping capacities of some of our partners, including UC and Children's Hospital. And we took the data from the census. So I said, rather than us guessing and trying to figure out these moving strategies, which frankly are hard to communicate, we need a map that tells us where people live, what the barriers are. We can put in the economic impacts. And so we have a heat map that tells us where we need to go to set up vaccine dissemination sites across this county. And so I know that both commissioners are utilizing that heat map as well as our systems so that we can plan forward. Once that pipeline opens up and we have more vaccine, we are going to be ready to set up vaccine sites that take into account transportation barriers, and we know where those transportation barriers are. We know those households that maybe have one car but maybe 6 people living in a location. So we're planned ahead to develop a strategy. The communication side of it is important. That the COVID-19 communityresources.com site we launched and have been able to build more direction and driving people to that site as a result of Hamilton County CARES Act dollars from our commissioners, enabling us to build a campaign that we can build upon. We've learned from that research where the hesitancy is, what the hesitancy is. We've also learned some valuable information about the difference in hesitancy within the Black and Brown communities, and where some of the conversations on mistrust and what we need to do from a communication perspective to ensure that information is delivered in a way that people can receive and that they can then act and make informed decisions. There's no question that tide of like how many people were hesitant is now getting smaller, but there's still hesitancy. But working with our Black physicians, with the Cincinnati Medical Association, with Black nurses, with the Nurse Practitioner Network, we are all coming together and bringing forth video messages. Our town halls have been a source. NAACP is a part of the partnership in the building of COVID-19 communityresources.com so that we can all make sure we're communicating that information the same, because communication is one of the topics we talk about all the time at the state. that is a challenge, and especially when information is changing rapidly. And I see Commissioner Kesterman shaking his head. Information is changing very rapidly. Dr. Lofgren, I'm sure, can relate as well. And so we want to make sure that we're working with all of the expertise. We want to also make sure that we are having the voices of Black physicians, Black researchers within all of our systems speaking to our population. Not just Black people, but brown people, all minority groups. But I think the information, and they want transparency. That's one of the biggest things we learned from over 6 focus groups, more than 500 people, actually 3,000 people participating in quantitative research that we've recently reported to our county commissioners. We have the information. We now have a heat map that helps us guide where we should go. And so I think when we get the flow of vaccine we need, we're going to be ready to ensure that there's equitable. And that mapping was all designed to make sure we have an equitable strategy of dissemination. And so, and the fact that we're all talking to each other, and that both the city and county commissioners are working together. All of our systems are working together. Dr. Lofgren leads Region 6 for the state. Again, we're looking at the data on a daily and weekly basis. They are all talking to one another. So I think we're poised to make sure that we use that information to inform equitable distribution, and having the vehicles to distribute that information through. Sorry, that was a lot of information.
No, that's good because it's a lot going on. I wanted people to know that we are working collectively, but also I think you hit the nail on the head, Renee. People get their information now how they want to get their information now. It's not everybody doesn't necessarily may not get it from the newspaper. They might not read the same newspaper. They might get it off of social media, but they're on different platforms. Some people got to get it by telephone because they're not on social media. So we have a lot of different ways that we have to reach people where they are. Iris Rowley submitted a question, and I'm going to let Commissioner Kesterman, if you could, and we talked a little bit about this. She wants to talk about private senior assistant living. So in other words, it's a private location, and they've had issues in Avondale where people want to get tested or want to get the vaccine, but the owner of I don't know how the owner can tell a private person who pays rent that they can't get this. But I want to bring that up to Commissioner Kesterman or Dr. Lofgren or NAACP, Joe Mallory, because I know you guys have been fighting on these issues. I mean, that's a barrier, that we have. Do we have, how do people deal with that, I guess is what Iris Rowley's asking. And I want to say Sandra from SOACT. Let me say that too. It's been active. Sandra from SOACT kind of brought it to our attention. Renee as well.
I just would love to speak to that just because it's a great example of when Sandra Jones Mitchell contacted me and said, I have a list. Can you help us make sure that we can get those individuals vaccinated? And so she was communicated with some information saying, hey, the building is saying that they are not going to let people in. And so here's what happened in a matter of, I would say 48 hours, maybe. That resistance that was communicated to Cassandra was then escalated to our health commissioner, who then escalated it to the state. And now they are going to be testing individuals, vaccinating individuals in that building. So the point is that because there were relationships in Avondale that enabled residents to have someone to talk to, and that frankly, then we could play a role in connecting the other dots. Now, should that be the case? Should that happen that way? No, but we know that things like that do happen. But because there was this communication that's happening across the commissioner, the health commission, the systems, we were able to address it quickly, and the state, responded, right? So hopefully that means if someone's even thinking or hesitating about denying someone the ability to come get vaccinated inside of the place that they live, they will think twice.
I love it. See, this is what we're talking about. Renee McHaffey Harris, thank you. Because I got that information and I didn't know where to go. I said, oh my gosh, I contacted our county health commissioner, and he contacted the city health commissioner. And then, you guys were going already on it and then took it up to the higher level. But this is the kind of stuff we're talking about, as Renee has indicated. There's people who want to do it. And we've got to make sure first the people that want to do it, because that encourages, when people see their friends, their neighbors, people that look like them doing it, and say, oh yeah, this is safe. That's even better than the government coming in and saying it's safe. If your neighbor, your church member, or what have you. And so the quicker we get those individuals that's ready to go getting it, and they see they get it, and then more people will want to get it. So thank you, Renee. That has been resolved. That is so.
Sandra Jones Mitchell, actually, who brought that to the attention of all of us. So.
Yes, and that's why it's important to have people on the ground. Now, I want to ask about a new vaccine. Right now, or can you all tell me, we only have 2 vaccines and it requires 2 shots. People have heard about a 1-shot vaccine. Can someone talk about that, or are we at that point yet, or are we just dealing with, what are we dealing with?
So I'll jump in. So what we're looking at that probably will come to be emergency use at the end of the month or early part of March is another vaccine from J&J. The 2 vaccines we have right now use the same method to deliver the same method, the same sort of type of vaccine. The J&J vaccine is different in how it works. And I think we're really excited about it because it's one dose. 2 may actually have a little less immediate side effects, and it's easier to transport. It's going to be easier to deliver in many respects. One of the challenges that we're going to need to make sure people understand is that its effectiveness is not quite as much as the 2 that are out. So the 2 that we have are remarkably and sort of kind of unprecedentedly effective. Preventing more than 95% of infections is really sort of unheard of. The J&J vaccine is going to be more in the high 70s in terms of effectiveness. Typically, that's considered a highly effective vaccine. So the other thing about J&J is that they can produce a lot more of the vaccine so that we can get it out to people. So I want to make sure that people understand this, that when this vaccine becomes available, it is effective and that it's not an inferior vaccine. So I think, people are going to say, well, I'm going to want the other vaccine. And really, we just need to get the shots into arms. And so in anticipation of that, we're going to want to make sure that people understand that we are excited about another vaccine, because it just gets into amongst everything else about not only reaching everybody in our community, but just frankly having enough vaccine. If our FQHCs had all the vaccine they want, we would be looking at a much different percentage of people that vaccinated. So we're excited about it. We're going to need to make sure that we get trusted people talking about how we're excited about this vaccine. It's not an inferior vaccine, but you're going to read about how it's not quite as effective as the mRNA. Has several advantages, not the least of which it's just 1 shot.
And then will it help with, are these vaccines help when they keep talking about the second strand? If anybody want to jump in on that. We're hearing that a lot out in all communities. The second strand is coming, and is this going to be strong enough?
So I think there are 2 things that I would say about the variants, as we call them, the new strains. One is that though the existing vaccines aren't perfect, they do give you some protection. And there's reason to believe if it doesn't prevent the infection, it's going to prevent some of the complication, less likely to have a severe disease. But the other thing which is why we want to get everybody vaccinated, if we get not only protect everybody who are at high risk, which is what we're doing now, but actually get the community vaccinated, then the virus will no longer be in our community and it won't mutate. So the faster we can get out in front of getting everybody vaccinated, the less likely we're going to have these variants or these mutations occur that will represent a second threat. That's why we're excited about anybody who's coming on with vaccine. We got to get the channels right. We got to make sure that people have access. But right now, it's about making sure that we're getting vaccine. As Joe has said, listen, there are lots of people are clamoring to get the vaccine. And I can tell you right now, there is not hesitancy out there. People want the vaccine, particularly who are high risk. Perhaps when we start to recognize that we're going to have to figure out how to encourage 28-year-olds to get the vaccine, that might be another conversation. But right now, we're out there trying to get the people, and this is all about getting vaccine to people at the highest risk to save lives. Because as the governor mentioned, actually, we're already seeing an impact in terms of decreased hospitalizations and the like, even in the last couple of weeks, by just being able to hit the nursing homes and what we have done.
Joe Mallory, you put in the chat, but I'm let you ask that question. You were asking about tracking at all locations.
Yes, I know that there's apprehension by some individuals to fill in that box, what their race is. But, that's one metric that would really let people know the percentage who are participating, so we don't have these unreported numbers, and actually it's higher than it really is showing. That if people would include their race, we will know, have a better picture of who all is participating in getting the vaccine.
Mm-hmm. With that, Commissioner Kesterman, Health Commissioner Kesterman, one of the things you're saying that we're going to be doing some more tracking and announcing numbers. How can what Joe said with the NAACP help with what we're doing?
So, it's important that folks fill out their vaccine registration completely. That said, there is always going to be that hesitation, and there's always some level of mistrust with government surveys like that. So, at the end of the day, I would love for folks to fill it out, but I can respect when they don't. And we're still, that's not going to change what we're up to. We are working hard as a health department and a community to get vaccine to our community. And at the end of the day, I think we're doing a great job. but that doesn't mean tomorrow we can't do a better job. And working with our partners, we're going to break down these barriers. Another barrier that got broke down today, up until yesterday, we couldn't take single doses of vaccine to those individuals that were homebound. And our state, working directly with the Centers for Disease Control, got permission now nationally to take vaccine single doses to individuals. And these types of barriers and these types of relationships that Renee spoke of, this is how we're making a difference in our community. We'll continue to do the best we can to track, and we'll continue to do the best we can to make sure that we're hitting the right folks that need to be vaccinated and getting it into our communities. But we're all just going to keep working as hard as we can to make this happen.
And when they call the NAACP, Joe is getting a lot of calls at the NAACP office. How does he connect to, get people to help? What would you all recommend?
So if there's partnerships that can be had, obviously our office is available to work together and to create additional focus groups and teams. If these are folks that are trying to get vaccinated but don't have internet access, probably redirecting them to 211 to help them through that process is the best tool. Our office is actually taking the approach for anybody who's over 65. We are actually calling ourselves. Folks that get registered on our website, we're calling them. So rather than making them use the internet or some sort of new app that we're using to do our vaccine clinics, we're picking up the phone and we're calling these folks. And I can tell you our experience is these are the most grateful individuals that our team has talked to. They're happy to have the phone call. They're impressed that we're calling them, and they're just thankful that they'll get the chance. But what's unfortunate is I have 40,000 people on my registration list that are 65 and older. 40,000 people qualify for vaccine today, and next week I have 900 doses. So clearly there's that gap, and I mentioned at the beginning of the show, there is a need to be active and try to get vaccine from all of the different providers, and those opportunities exist, but the less computer savvy you are or the less time you have, the more difficult it is. And our team is working to break down those barriers, but we're not there yet.
And Renee, McHaffey Harris, we're wrapping up. What should we be doing with the closing the health gap? Because people are saying, man, I got a call all over the world trying to get a shot. What's going on?
Well, what I would love to do, and I will talk with Joe more offline, we launched a site on March 23rd of 2020 called COVID-19communityresources.com. Now, granted, if you have internet access limitations, that might be a challenge. But we also have a phone number that's on the billboards that the County CARES Act dollars supported.
Tell them the phone number real quick before we go off the
585-9879. 585-9879. That number is manned. And we can redirect you or at least get you to the right information. We also have been asked by the state to design a toolkit, which will be disseminated across the state through NAACP chapters in 15 sites across the state, and then be made available to many organizations. We're designing it from the Health Gap. We are obviously going to make sure it's utilized.
Hold that thought because our radio's shining off. I want to thank our guest governor, Mike DeWine, County Health Commissioner Greg Kesterman, Dr. Richard Lofgren, UC Health, Joe Mallory, Cincinnati NAACP, Renee McHaffey Harris, closing the health gap. Thank you all for being part of this virtual where are we at right now, COVID-19 with the vaccine. Thank you all for tuning in. And don't forget, we'll be back tomorrow, or you can call my office, 946-4401.
Thank you, Commissioner.
Okay, so we're still on live with Zoom. I do want to give, you got a toolkit coming out. That's going to, and you're partnering with the NAACPs all around the state. I didn't want to cut you off on that.
Oh, no, that's okay. So this came out of the governor's task force work. We wanted to address communication. So they asked us to design a toolkit. In that toolkit will be videos. There will be a fact sheet, an FAQ, a fact sheet so that frequently asked questions from the research we've done and other information collected across the state. We'll have a sample of like how you can bring together a group of people to help educate the community, like example of who should be included from the commission, having the health department, having a Black physician, having Black nurses, nurse practitioners, and other leaders lead those conversations so that there's this toolkit of information that can be disseminated in churches and in social civic organizations and urban leagues and other organizations across the state. Communication, I think, is the key, and because the information is changing so rapidly, it will be an online tool that you can download, but we're also making physical copies available as well. It's not as easy to update those physical copies, so we're going to rely on the electronic version to be able to add new information. Radio One, even our local TV stations, not just here but across the state, are looking at ways that they can play a role with PSAs as well. And I think that if we keep talking to each other, I think unfortunately what we can't control is that people call who they trust or have a relationship with. So it's important that all of our organizations, and I can speak to the system side of this, I think that the systems, the health departments, some of the larger organizations are all in similar conversations and sharing information. But what we need to make sure of is that that information is informed by what is happening on the ground. And so I think that's the opportunity. And I think that we all are saying we want to make that happen. And so I know that we will continue to work with our partners in NAACP, the Urban League, African American Chamber of Commerce, and the Cincinnati Medical Association has been incredible. Their doctors are going with me when asked to do vaccine education sessions. We're going to organizations that are saying, hey, we need to educate our employees. And so we have Black physicians that are working alongside of the Health Gap and all of our partners to make that information possible.
Absolutely. Dr. Lofgren, I'm so glad to have had you on today as well, and the work that you are doing, and you are a representative, as Renee has said, on the statewide level. Is there anything else that we should, people that are watching should know?
I think that there are probably two things. One is that there's a lot of good effort trying to get on to really meet the needs of the community. And I think that Renee really captured it, is that, making sure we have adequate vaccine is something we're all working on. But in the meantime, it really is the coordination of the communications, and that people are getting information, as she said, from their trusted partners. And we're working hard to make sure that all the organizations involved are trying to work those networks, because it is very local that you really find information about, and these connections about where people are going to try to get information and how we can direct them. One of the things, maybe the only other thing I'd emphasize, is that the United Way stood up to really help with 211 is another area that people can go to start if they're not sure where to go in terms of, particularly if all they have is a telephone, because a lot of this is online, which is a real barrier.
Absolutely. Joe Mallory, NAACP. I know Renee talked about the partnership. Is there anything else that you want to make sure that's communicated?
No, I just wanted, we do have to tighten up our communication, because we all get busy and there's a lot of COVID information. It's like COVID overload, and just drilling down to just some talking points, the basic information that is current, because it always changes. So we have to do the update and do the current information, and then just talk to each other more. We all have a lot on our plate, and I'm trying to wear multiple hats, and I try to get other folks involved as much as I can, but I know sometimes I have to take the charge and then delegate it to someone else that can help take it a little bit further than I can.
Yeah. And I think on the positive side, this is the first time that I've been at the city as a vice mayor of Cincinnati. I've been at the state as a state representative, and now at the county. But this is my first time that I've seen us come together and kind of break down those silos, because usually it's like, oh, what healthcare system are you in? Your doctor, you can't be at this hospital because your doctor's not at this hospital. You got to get over here. You're at that hospital. And it just was tough, but I do want to commend that everybody, or for example, that's your health department. You can't come over here. That's their health department. It was kind of like everybody is saying, break down these silos, and it's, one Hamilton County, and we're all trying to help you and get the information out. And I think that is, commendable, because that's what has to happen when we talk about people's, life. It's life and death, and everybody's saying, hey, I don't care if you at this hospital, it's not my hospital, but I'm gonna tell you, this is what you need. This is the shot, and I just really appreciate it, versus it's not a competition. It's more everybody working together. I'll leave it at the last word. Our county health commissioner, and one of the things we learned is the county health commission is part of kind of an arm of the state board of health. So you have to kind of go along with whatever the state board of health says. Your job is implementation. And so I just want to say that when people say, oh man, why can't the county health commissioner, why can't we open up Paul Brown Stadium and open, Paul Brown Stadium? We don't have enough to open up the concession stand at Paul Brown Stadium right now.
Right.
So we do have to get more from the federal government, and I'm hopeful that our new administration will get us the supply we need. We have a supply problem, which has created a distribution problem. So do you want to leave us with how people can, maybe get in touch and be routed to the right place? The governor's put a challenge out there. The churches, if you want to do this, call your county health commissioner. So do you want to?
Yeah, so our website is really the best source. We've got a form where you can ask a question or file a comment. And so, yeah, if you have an interest in being part of our partnership, we'd recommend you go to our website, which is hcph.org. And the one other thing, everything we've talked about today is very hopeful, and I'm very excited about all this vaccine talk and all these partnerships. But the one thing I want to make sure to say, we are still living with 7,000 active cases of COVID in our community today. So if you can do one thing for me this weekend and beyond, it's continue to wear that mask, continue to social distance, wash your hands, and if you're feeling sick, stay home, because we got to get through this as a community. We're not there yet. We don't have enough people vaccinated, but each of us has the ability to help Hamilton County be successful in managing this pandemic.
Sure.
Especially, I forgot to ask the governor, I'll let him say this, now that the curfew is over, not saying that the curfew could curve, that's debatable. If if COVID only comes in after midnight, that's debatable. But the point is, now that there's no curfew, and some people will take that as, okay, let's, pack these places out, pack out these restaurants, pack out, it's time to get back to partying as usual. You would say what?
It's not the time to party. We can get together with our families and the folks that have been part of our close circle. But if we start letting our guard down, we're going to see those curfews come back, and we're all looking forward to all of these orders going away. And so it's now our turn to try just to get us a little bit further until everybody's vaccinated, and then we can get life back to normal.
All right, wear your mask, wash your hands.